Medicare will cover weight loss surgery. What? I know it's surprising, but it's true. So we've done several videos about some of the surprising things that Medicare actually doesn't cover. But today, let's keep it positive and talk about some of the surprising things that Medicare does cover. First, let's talk about some of those recent and upcoming 2024, 2025, and beyond changes, and then we'll get into those surprising benefits that Medicare already covers that you may not know about. First, let's talk about telehealth. I love telehealth, don't you? When you're feeling crummy, but it's something pretty run-of-the-mill like a sinus infection, it's so terrible to have to drag yourself out of bed and go sit all stuffy-nosed in the doctor's office just waiting to get a prescription. So telehealth is super convenient. And of course, as you likely know, telehealth was expanded for Medicare during the COVID pandemic, the height of the COVID pandemic. But not only does it look like it's here to stay, but they may actually be expanding it in years to come. Speaking of expanded benefits, let's talk about the expanded mental health coverage. Now you can see a family and marriage counselor, which is very important. It's not like marital issues go away just because you're over the age of 65. And also, outpatient care has been expanded as well. Many people fall sort of between the gap between inpatient care for mental health services and outpatient care. So Medicare took some steps to fill that gap by offering more intensive outpatient services. Now this next one is a video unto itself, and it actually is a video unto itself, so make sure to stick around to the end of the video to learn more. But there are huge changes coming to Part D. It's too long to list all of them, but there are two big changes that I want to highlight right now. So for the first time ever, the federal government was actually able to negotiate prices on behalf of Medicare. And this is huge because it's estimated that somewhere around 1 in 7 can't afford their prescription drugs. We discussed these drugs in another video, but now we actually have the negotiated prices. And please forgive me, I'm definitely going to mess up the pronunciation of some of these. Feel free to correct me somehow phonetically in the comments below. So Eliquis has been negotiated down from $521 to $231. Xarelto has been negotiated down from $517 to $197. Januvia has been negotiated down from $527 all the way down to $113. That's very significant. Jardiance has been negotiated down from $573 to $197. Enbrel down from $7,106 to $2,355. We're getting into some of the really expensive ones. Imbruvica down from $14,934 down to $9,319. So you would definitely meet your catastrophic coverage there. Farhixa down from $556 to $178. Entresto down from $628 to $295. Stelara down from $13,836 all the way to $4,695. Again, catastrophic coverage. And Fiasp and Novolog down from $595 to $119. Feel free to pause on this screen if you want to see any of these more carefully. The next huge change for Part D has to do with catastrophic coverage. Now, recently, the 5% charge, the 5% coinsurance that you would be charged in catastrophic coverage was eliminated, but the threshold was still pretty darn high at $8,000. And in 2025, that catastrophic coverage threshold will drop down to $2,000. That means Medicare is keeping track of your out-of-pocket spending, and should you spend $2,000, then Medicare will pay for the remainder of your Part D drug costs for the remainder of the calendar year. And I would be remiss if I didn't mention the donut hole is gone. A brief pause here. If you like what you're seeing, and we hope you do, please make sure to click like to help us get this video out there. And also make sure to subscribe to stay up to date. Now, if you have any questions whatsoever, you can reach us in the comments below. We are licensed nationwide. There's no charge for our services. You can also reach us at the number on the screen. All right, let's get back to it. So first on our list of surprising benefits you may not know is covered, I sort of already gave away at the beginning of the video, and that's bariatric surgery. So weight loss surgery, bariatric surgery, laparoscopic surgery can actually be covered by Medicare, and this was certainly not always the case. Now, we've said in other videos that Medicare does not cover hearing, and that's pretty much true. Medicare certainly doesn't cover hearing aids. However, if a doctor deems it medically necessary, you can have up to 1 hearing exam per year. Now, if it's determined that you do need hearing aids, as I said, those won't be covered by Medicare. However, recently, hearing aids have become available over the counter, which would drop your hearing aid costs from thousands of dollars down to hundreds of dollars. We've also mentioned in other videos that Medicare really doesn't cover vision. And again, this is mostly true. But of course, Medicare will cover once every 12-month glaucoma screening if you're considered high risk. And they will cover one standard pair of glasses from a Medicare-approved supplier if you have to have cataract removal surgery and an intraocular lens is implanted. Again, that procedure has to be covered by Medicare first. Medicare will also cover some foot and podiatry services. For example, diabetes-related foot problems, lower nerve damage in your legs, risk of limb loss, hammer toe, or some type of bunion deformity, or heel spurs. This next one is a huge surprise. Did you know that chiropractic care and even acupuncture can be covered by Medicare? Now, this is not acupuncture in the general wellness sense. It's really to treat a very specific medical condition, which according to Medicare is lower back pain. And for chiropractic care, it has to be specifically sublation or manipulation of the spine. Counseling to quit tobacco is also covered by Medicare, and this is very important not just for your overall general health, but remember, this is something that Medicare supplement plans may take into consideration when they're doing their medical underwriting, if you are subject to medical underwriting. So with Medicare, you can receive up to 8 face-to-face visits in a 12-month period. And finally, did you know that Medicare can cover coverage outside of the US? With some stipulations, of course. Now, if you do need more intensive coverage outside of the US, then look into Medicare supplement plans because they do often that foreign travel exchange. However, Medicare will not only cover coverage and benefits in the continental US and as well as Alaska and Hawaii, but American Samoa, Puerto Rico, and the US Virgin Islands. So there's a little bit of travel already covered. However, if you are planning on traveling more extensively, perhaps abroad, we highly recommend that you look into a Medicare supplement plan or at least some type of travel insurance. If you want to learn more about that, make sure to check out this video right here, all about traveling with Medicare. And of course, if you want to learn more about Medicare in general, make sure to check out our Medicare playlist. If you do have questions, you can reach us at the number on the screen or in the comments below. And as always, please make sure to like and subscribe. We'll see you next time.